Microbiology for GNM Unit 1, Scope of Microbiology in Nursing. Introduction: Microbiology is a crucial discipline in nursing as it deals with microorganisms, which are integral to healthcare. These microscopic organisms exist everywhere and can be either beneficial, normal flora, or harmful, pathogenic. Nurses frequently interact with the microbial world while managing outpatient health and ensuring infection control in hospitals. A deep understanding of microbiology helps nurses prevent and control infections, ensuring patient safety and quality care. Medical microbiology and its branches. Medical microbiology focuses on microorganisms responsible for diseases and their management. It is broadly classified into bacteriology, study of bacteria, unicellular organisms; virology, study of viruses and their impact on human health; parasitology, study of parasites, unicellular to multicellular organisms; mycology, study of fungi and fungal infections. Scope of microbiology in nursing. Understanding microbiology enables nurses to recognize the relationship between microbes and human health, identify the risks associated with immunocompromised patients, learn about microbial reproduction, morphology, biochemical properties, and genetics. Stay updated on emerging diseases and molecular identification techniques. Understand the role of microbes in developing medications and vaccines. Importance of microbiology in nursing practice. Nurses are responsible for infection control and patient safety. Microbiology knowledge helps them to protect patients and themselves from harmful microbes. Apply microbiological concepts during patient care and medical procedures. Prevent the spread of infections in hospitals and communities. Maintain sterile environments by practicing proper sterilization and disinfection techniques. Ensure proper specimen collection for accurate diagnosis. Implement immunization programs effectively. Role of microbiology in nursing. A strong foundation in microbiology equips nurses to combat infections in both individual patients and hospital settings. Effectively collect and analyze clinical specimens. Administer targeted treatments by understanding microbial mutations and antibiotic resistance. Implement sterilization, disinfection, and aseptic techniques in healthcare settings. Ensure proper biomedical waste disposal to prevent outbreaks of deadly diseases. Conclusion: a comprehensive understanding of microbiology empowers nurses to provide effective nursing care, prevent and control infections, and contribute to better healthcare outcomes. Through knowledge and practice, nurses play a vital role in ensuring patient safety and public health.